Have you ever pondered about the power of the mind over the body? Ever heard of a disorder where psychological stress manifests as physical symptoms? Welcome to the intriguing world of functional neurological symptom disorder, or FNSD for short, also known as conversion disorder. This is a condition that truly demonstrates the profound connection between the mind and the body, blurring the lines between what is physical and what is psychological. FNSD is a psychological disorder, which means its roots lie in the mind. But don't be fooled by the term psychological. This doesn't mean the symptoms are all in your head or imagined. Quite the contrary. The symptoms of FNSD are very real and can be quite debilitating. In FNSD, psychological stress or emotional trauma transforms into physical symptoms. What's fascinating is that these symptoms cannot be explained by a medical neurological disease or any other medical condition. For instance, a person suffering from FNSD may suddenly lose the ability to walk or talk, or they may experience seizures or paralysis despite no physical cause for these symptoms. It's like the brain's software has a glitch, but the hardware remains unaffected. The mind, under severe stress, is somehow able to convince the body that it is physically ill. And the body, in turn, responds with symptoms that mimic those of a neurological condition. Now, you might be wondering, how is this possible? How can the mind have such a profound influence on the body? Well, the exact mechanisms are still not completely understood, but what we do know is that our brains are incredibly complex and powerful. They are constantly processing a barrage of information, both conscious and unconscious. Sometimes, under extreme stress, this system can go awry, leading to FNSD. So there you have it, a brief introduction to functional neurological symptom disorder, a puzzling condition where the mind has the power to manifest physical symptoms, despite no apparent physical cause. Now that we've delved into what functional neurological symptom disorder is, let's explore its diagnostic criteria. So, how do health professionals determine if someone is suffering from functional neurological symptom disorder, or FNSD? The answer lies within the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, more commonly referred to as the DSM-5-TR. This manual is essentially the Bible of psychiatry, containing guidelines and criteria that professionals use to diagnose a broad range of mental disorders. Now, let's delve into the specific criteria for FNSD as outlined in the DSM-5-TR. The first criterion is that the patient exhibits at least one symptom of altered voluntary motor or sensory function. Think of it as a sudden inability to move a limb or a sudden loss of sensation that the person can't explain. The second criterion is that clinical findings provide evidence of incompatibility between the symptom and recognized neurological or medical conditions. That's a fancy way of saying that the symptoms don't match up with any known neurological disorder or other medical condition. Let's put that into perspective with an example. Imagine someone who suddenly becomes paralyzed from the waist down, but all their medical tests come back normal. That could potentially be a case of FNSD. The third criterion is that the symptom or deficit is not better explained by another medical or mental disorder. This means that before diagnosing FNSD, health professionals need to rule out other possible causes of the symptoms. The final criterion is that the symptom or deficit causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. In other words, the symptoms significantly interfere with the person's day-to-day life. To illustrate, consider an individual who, due to unexplained loss of speech, can't perform their job or communicate with their loved ones. This would significantly impact their life, potentially indicating FNSD. Remember, each case is unique, and the presence of these criteria doesn't automatically mean a diagnosis of FNSD. It's a complex process that requires careful evaluation by a trained professional. With the diagnostic criteria in mind, let's shed light on the potential causes of this intriguing disorder. What triggers this mind-body disconnect that we see in functional neurological symptom disorder? Now, that's a question that has intrigued scientists and psychologists alike. The causes of FNSD are multifaceted, often rooted in a complex interplay of psychological and physiological factors. Let's start with stress. Imagine you're a soldier in a war zone. The constant gunfire, the fear of losing your life, the uncertainty, it's a level of stress most of us cannot fathom. In such extreme situations, the brain may respond by converting this psychological tension into physical symptoms. It's as if the mind is shouting, "I can't cope with this stress, so let's make it something the body has to deal with." Next, let's talk about trauma. Picture a child growing up in an abusive household. The emotional scars run deep and sometimes they manifest in physical form. This child may develop symptoms like paralysis or seizures, not because there's a problem with their nervous system, but as a way for their mind to communicate their emotional pain. Then there are the other psychological factors. Depression, anxiety, personality disorders, these can all play a role in the development of FNSD. For example, a person with severe anxiety may start experiencing tremors or other neurological symptoms, not because of an underlying neurological disease, but as a result of their intense fear and worry. Now let's look at some real-life examples. Consider the case of a firefighter who developed a stutter after rescuing people from a burning building, or a woman who started having seizures following the sudden death of her husband. These are not just random occurrences, they are the mind's way of dealing with overwhelming stress or trauma. In conclusion, FNSD is not just about the physical symptoms, it's a complex disorder that often has its roots in psychological distress. The mind and body are intimately connected, and when the mind is in pain, the body often follows suit. Understanding the causes brings us one step closer to comprehending this disorder. Now, let's delve into its symptoms. What physical symptoms might one experience with functional neurological symptom disorder, and how can they be treated? Functional neurological symptom disorder, or FNSD, can manifest in a variety of physical symptoms. These can range from paralysis to seizures and even blindness. It's crucial to understand that these symptoms aren't under the person's conscious control, and they can cause significant distress. One of the most common symptoms of FNSD is paralysis or weakness in a part of the body. This could be a limb, a side of the face, or even the entire body. The person with FNSD might find themselves unable to move or feel sensation in the affected area, despite there being no physical cause for this paralysis. Seizures are another common symptom. These aren't epileptic seizures caused by abnormal electrical activity in the brain. Instead, they're non-epileptic seizures caused by psychological factors. They can look like epileptic seizures, but they don't show up on EEG brain scans. Other symptoms can include tremors, difficulty walking, loss of balance, and even loss of voice or vision. Each person's experience with FNSD is unique and their symptoms can vary widely. So how is FNSD treated? The primary treatment for FNSD is psychological therapy. Cognitive behavioral therapy, or CBT, is often used. This therapy helps the person understand and change thought patterns that lead to harmful behaviors or distressing feelings. In some cases, physical therapy might be used in conjunction with psychological therapy. This can help manage symptoms like paralysis or difficulty walking. It's also essential to treat any coexisting mental health conditions such as anxiety or depression. Medication isn't typically used to treat FNSD itself, however, it can be used to treat coexisting conditions or symptoms like seizures or anxiety. The journey to recovery from FNSD can be challenging and can take time, but it's important to remember that help is available. With the right treatment and support, improvement and even full recovery are possible. While FNSD might seem overwhelming, remember, help is available and recovery is possible. Intrigued by the complexities of the human mind and its impact on behavior? Welcome to PsyEduInsights, your reliable companion on this journey of unraveling the mysteries of human psychology. We are a dedicated platform with a mission to make the study of psychology accessible to all. Not just to students, but to anyone with an inquisitive mind, eager to delve into the fascinating world of the human psyche. Our endeavor is to break down complex psychological concepts into digestible insights. We believe that the more we understand about our minds and behaviors, the better we can navigate our lives, our relationships, and the world around us. Here at PsyEduInsights, we cover a wide range of topics. From understanding mental health disorders like the functional neurological symptom disorder we've explored today, to diving into the depths of human emotions, motivation, and personality development. We also delve into the intriguing spheres of social and cognitive psychology, unraveling the ways in which we interact with others and the world around us. We're not just about theory, though. We make it a point to bring in real-world examples and case studies to help you see how these concepts play out in everyday life. It's one thing to read about a disorder in a textbook and quite another to understand how it affects a person's day-to-day existence. Our goal is bridging the gap between the classroom and the world, between theory and practice. We're here to help you connect the dots, to see the bigger picture of how psychology shapes our lives. So, Whether you're a psychology student looking for a deeper understanding or a curious observer eager to understand the human mind, PsyEduInsights is here for you. We invite you to explore more, to question more, and to learn more. Thank you for joining us on this exploration of functional neurological symptom disorder. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery. Subscribe to PsyEduInsights for more insightful content. Until next time, keep learning.